The National Health Service is the 5th largest employer in the world. We employ around 1.3 million people, so you might imagine we have some huge challenges facing us from a workforce perspective. And whilst I could drop into the details of some of the specifics, actually for me I think I could summarise the challenge we face, like most employers, with 3 broad headings. First of all, capacity, making sure we have the right people with the right skills doing the right work at the right time. Secondly, capability, making sure that we've got those right skills deployed in the right way and we're supporting the development of staff to maximise their talent and produce the best possible clinical outcomes for patients. And then of course the third one, and that trumps both of the others frankly, is culture for me. And that's about ensuring we're an inclusive employer. We've got staff who feel supported, who feel safe, who feel able to give us their best, who feel connected back to the NHS Constitution and its values in delivering the right possible standards of care. And most importantly, that's because we know from really long-standing research that better staff experience, which is effectively what I'd call the employee value proposition, better staff experience leads to better patient outcomes and actually leads to lower levels of mortality. So for us in the NHS, it really is a matter of life and death. Sustainable workforce engagement is absolutely fundamental to meeting future challenges for the NHS, whether that's about the right standards of clinical care or it's about bridging the 3 gaps that we describe in the NHS 5-year forward view about improving prevention, improving health outcomes and reducing the financial gap, because like the rest of the public sector we have a duty to help manage the taxpayers' bill for the NHS and make that as efficient and effective as possible. But to achieve that, with 66% of our overall costs being around people, fundamentally the only way we're going to achieve that is through long-standing and effective workforce engagement. We need to do that in partnership with our staff side partners in the trade unions and the Royal Colleges, but fundamentally it's about how do we engage, support, harness the ideas from 1.3 million people across the whole of the NHS to help transform it, to make it affordable, to make it sustainable, but fundamentally still free at the point of clinical need.